Thanks for the introduction. To give you an idea how long I've been doing this, so Dina mentioned I was her team doctor. And what she won't tell you is that she was the only athlete I've ever known who was captain of not only the track team, but the soccer team at the same time. So that gives you an idea of the level of athlete she was. So my goal in the 7 minutes we have is to talk about what we call the Healthy Runner Project. Just as an aside, when we first started the study, we called this the Injury Prevention Project. Nobody signed up. Couldn't get the athletes to sign up. Coaches wanted no part of it. Changed the title, didn't change the study, to the Healthy Runner Project, and they all wanted to be part of it. So this was a 7-year project. We did collect historical data for 3 years. In fact, Emily helped with this when she was a resident. We then piloted the project for a couple years and then had our intervention phase for 4 years. So we were collecting data for 7 years. And the goal was really just, could we use a nutrition intervention to prevent bone stress injuries in our collegiate runners, particularly our women runners? We also looked at the males as well, but I won't go over that today. So this was our historical data. This is from 2010 to 2013. And basically, combining between UCLA and Stanford, 20% of the runners were developing a bone stress injury every year. 35% of the females and 10% of the males. At Stanford, it was as high as 38% of our females were sustaining a bone stress injury every year. And many of them were in the pelvis. It got to the point where actually one of the senior associate deans said, "What the heck are you doing to these young women?" So we knew we had to do something. There's a lot of risk factors in terms of why you develop a bone stress injury. I won't go into all this today, but it could be your training, it could be impact forces, bone health, or gait mechanics, and oftentimes it's a combination of several of these. But invariably, there's some type of overuse history, even in our Stanford athletes. So this is an actual case. It was a high school runner. We host the Stanford Track and Field Invitational every year. I see Coach Clark there. And it's a big meet for us. We have probably 5,000 kids here over 2 days. And this isn't the actual picture of the athlete, but that's her actual x-ray. So she's just running around the track and just collapses. Like nobody hit her, nothing really happened. And that was her x-ray. Now that's the kind of x-ray we see with a traumatic injury. This just happened spontaneously. So you have to say, what the heck is going on here? And this is where we talk about red S or the female triad. We now talk about the male triad. I won't go into the detail of this since I think everybody's familiar with it. But at the core of this, what really sets it off is energy availability. And so that's what we focused on for our study. If you can control energy availability, you can help control menstrual function and you can have an impact on bone health. Just to point out, we've also published these consensus papers showing that this exists in males as well as females. And this was our study. Briefly, the athletes filled out an extensive risk factor questionnaire on their injury history, their sports history, and for the women, extensive history in terms of their menstrual history. They met with a dietitian, and we'll go into the detail on that. They had access to a Run Fueled app. They all underwent DEXA scanning to look at their bone density. And then these were some of the labs that we collected. A lot of this more for research purposes. But this was our goal, to see if we could keep the athletes in positive energy balance. And we defined balanced energy availability as 45 kilocalories per kilogram for fat-free mass per day, and low energy availability at less than 30. So they all had a talk by our team dietitian, Kristen Gavani, who is here with us today. So that was with the whole team. And then they met individually with her. And so they would evaluate dietary intake, eating patterns, any dietary restrictions, what their access was to food, supplement use, and really tried to keep it very simple. So just each season, have them come up with 1 or 2 goals that they could work on. So we tried to keep it not overwhelming, something that they could easily accomplish. And then it might just be adding a snack. It might be increasing energy-dense foods, more carbohydrate-rich foods. Some cases increasing calcium or vitamin D, maybe just adding a meal or more frequent snacks, or maybe make sure they're fueling right after their workout. And then every season we would go over this with the athletes. So these were our results. And it was really pretty interesting just because at Stanford, we had dramatic results. We cut our bone stress injuries down by over half. And these numbers are more in the way we had to define it, just because many of the athletes had more than one bone stress injury. But Stanford women had a reduction from 63 injuries per 100 person years to 27 injuries per 100 person years. So that's over a 50% reduction. At UCLA, there was no change. Now, nothing against UCLA. We have some reasons why that may have happened, which I think is interesting unto itself. And our intervention focused particularly on the trabecular-rich bone. And so why is that important? Trabecular-rich bone is more impacted by metabolic factors, such as in a low energy state, which many of these athletes were in. So this is, for instance, the femoral neck, the sacrum, the pelvis, or even the calcaneus. Cortical bone is more of your long bones, such as your tibia, femur, fibula, and these are more susceptible to more biomechanical shearing forces. So when an athlete has a stress injury in trabecular-rich bone, you automatically think about something in terms of a low energy state. During our study, over the pilot phase and the intervention phase, the menstrual irregularity decreased, so they had improved menstrual function. And interestingly, their bone density increased at the spine. And this is what you would expect, because the spine is made up primarily of trabecular bone, and this is where we're going to have the greatest impact, is in trabecular bone. And this is where we saw the increase in bone density. So just to summarize, we saw steady declines in our bone stress injury over the study period with our Stanford women with this simple nutrition intervention. Why didn't this happen at UCLA? It could be that they had a coaching change, which can sometimes disrupt things. They had a dietitian change. I think the biggest thing, though, is that it took time, but we were able to get buy-in from everybody, from the coaches, the athletes, the administration, to really change the culture of the team. It got to a point where, just to finish up, like one of our women's distance coaches was actually during team meetings going over she bought them a nutrition book, so going over different recipes and ways they could stay healthy and work together on this. And it took time, but by changing that culture, it really made a difference. So just thanking our research team, and I will end there. So great, thank you.